many of our treatments to date have been targeted against the seizures. And yes, seizures are important in Dravet syndrome, but we know there are other factors that, or problems that really do trouble families and the children themselves. Obviously, the fact that they show little in the way of neurodevelopmental progress, so their IQ appears to drop. That doesn't mean to say they lose skills, they just don't progress relative to their peers. And behaviour and communication, which becomes quite problematic to a varying degree, but can become quite problematic. And the problem we have is we are treating symptoms. If we're suppressing the seizures, they are one of the symptoms in Dravet syndrome. The learning and the behaviour and the communication are other manifestations and are symptoms, but we haven't got anything really to target that. Yes, in some of the behaviours, such as attention difficulty, we can treat them as we would any other individual with attention difficulty, but actually it's not targeted at the cause. So cannabidiol and perhaps to some degree fenfluramine is targeted at the seizures. Some of the, we're waiting to see whether fenfluramine is effective in any other types of epilepsy. There are some animal studies that suggest that it has a very specific mechanism that may be relevant to Dravet syndrome, and indeed some of the early data suggests there may be some improved attention in children who go on fenfluramine from the studies. So there may be some degree of symptom targeted treatment there, but we don't know yet, and it wasn't designed that. We have done our trials to look at seizure control, and we're waiting to see whether it has any other benefit. When it comes down to it, the problem is the genetic problem. It's the sodium channel mutation, perhaps not just that we find, but maybe other hidden genetic problems that is the real problem. And it's that probably needs to be targeted if we're going to have an overall effect on the long-term outcome of these children. We have some genetic studies planned. In the first instance, looking at antisense, which means we're bypassing a problem to enhance the production of proteins in the brain. But then there are also animal studies looking at other more targeted gene therapies. These are very early days, but it's something that we have to look towards if we're going to have an effect on the overall condition and not just treat the symptoms.